guys, welcome back again to another talk about what's in the research and what's going on out there and how myofunctional therapy might be able to help integrate some of these systemic healthcare concerns. Tonight's topic is going to be over snoring and what you should do, what we can do, just kind of an all around coverage of what to expect or how to screen yourself and your partner. Let's see. Just a quick introduction. Snoring is not just an annoying problem. 80% of the people that have had a history or a chronic history of snoring have probably already progressed into some sort of obstructive sleep apnea or OSA. This leads to heart disease, high blood pressure, weight gain, and even exacerbates or worsens the possibility of getting diabetes and even early onset Alzheimer's and cancer. So it's a very widespread problem. It's something that a great percentage of our population is dealing with, and it's one of the reasons professions like myofunctional therapy are coming about, because we have to hit this integrative approach to a problem to actually get to the core of it. Snoring itself can cause damage. It's not just down the road long term stuff, but the snoring itself causes these vibrations that damage the muscles and the nerves in the soft palate, and it'll cause elongation of the uvula and draping of the soft palate, which adds to further obstruction. So if it started out as an innocent snore and it's gone on to be a chronic issue, that's how you progress into that next phase. Because with all of that, we're probably doing a lot of mouth breathing, and the more mouth breathing they do, of course, the more that we're going to be snoring and the more draping and misfire that we're going to have back there. Snoring can cause a number of maladies. It also will cause us to release cortisol at night while we're sleeping, and this is a stress hormone. So currently all hormonal imbalances are treated via medication. The problem is when we identify that this is a hormonal problem and only treat that problem, we're not getting to the cause or the underlying cause of that hormonal imbalance. So yes, we have these stress hormones going in our body and we need to definitely do something about it. But if the doctors that are treating us for this are treating the weight gain symptoms or the stress or the anxiety related to cortisol, and they're not ever addressing the sleep, then we're never tackling the underlying source of the imbalance. Snoring can cause loss of sleep in your sleep partner as well, not allowing them to get into the deeper stages of sleep. So we've got to get to stage 4 or 5 to restore our physical and mental health. One of the quick screening questions you can ask them if you're worried that they're not even realizing that you're interrupting or that they're interrupting you is, are you dreaming? You should be dreaming and remembering your dreams nightly. I'm not saying crazy, vivid things, but dreaming is a normal process. It helps our mind slow down, digest our day, accept reality. And without hitting those deeper phases of sleep, are we really restoring and preparing ourselves for life? Snoring will worsen over time, and it is a sign that you should be tested for sleep apnea. That is something that should be done with a sleep medicine doctor. There are a number of facilities out there. If you have health insurance, they can direct you. Your primary provider can direct you. But if you're dealing with this or a loved one is, then it's something that should be addressed. No longer are the days that I want people to think, oh, sleep or snoring is nothing. It's something my father did, my grandfather did. Just because they did it doesn't mean that it's normal. Doesn't mean that they didn't die sooner or not have the quality of life that they deserve to have because they accepted that condition. So I mentioned the elongation of the uvula, and I know that if you're outside of the medical realm, this is something that you might not see every day because you guys don't go digging around in mouths. And so let's bring this up. The uvula should be short and firm and not long and flabby. The elongation is damage directly caused by snoring. The muscles and nerves are being damaged in the soft palate. So you can see that there's a little animation here or cartoon that does a nice clear cut And they're never this easy to read in reality. But then the other three images I have, you can see the top right is a little long and it looks like it touches the back of the tongue. So if I was comparing to the cartoon, I would say that's a grade 2. But then I want you to look at this bottom left one. They actually flipped that guy forward with that tongue depressor because it's elongated. I want you to notice that you can't see the posterior arches of this guy's throat at all. So he's advanced in his Mallampati score as well. And then that third picture, look at it, like sits on there like a snake, all the way, lays on the tongue all by itself. So that's pretty impressive there. So I know I use the word Mallampati, however you want to say it, and when you address different professionals, they're going to use the word slightly differently. And it's very similar to a couple other ways to address the airway or measure how much visual airway space that you have. But this one's the one that you stick your tongue all the way out, don't say ah, and we look at the back of the throat. And so you can tell that there are 4 degrees of it here. And the first one, normal size uvula, nice open. You can see the soft palate and the posterior arches, and all the way back there, that's the posterior wall of the oral pharynx. In Mallampati 2, you can see that the uvula looks like it almost touches the posterior portion of the tongue. So we can still see there's some air space back there, and we can see most of the uvula. On a 3, you can only see the stalk, or like the little start downward part of the uvula, because we've lost so much. We've had some draping of that soft palate. And then when we have a Mallampati 4, in that last picture there, we can't see the uvula at all. It is completely gone to us. This is just another set of pictures that shows the exact same thing, but it's 4 different patients where you can kind of see the evolution of how we should be able to see everything all the way back there to we can no longer see different things. And this is caused by a number of different concerns and would be addressed in different ways. Another thing that affects that airway back there that could be part of an obstructive sleep apnea are the tonsils. So in this top picture here I have in green, the tonsils should be within those pillars back there. When we go to a grade 2, 50% of the midpoint, or I'm sorry, less than 50% of the way to the midpoint. So they're not all the way halfway there. When we go to a 3, they're over halfway to the midpoint line, and a 4, the tonsils actually meet at the midpoint. And I put this second little strip. These would be taken from like an endoscope from a nasal view, looking down onto the epiglottis and looking at the airway itself, and you can kind of see how those tonsils encroach upon and cover, and they literally will obstruct the passage of air through the pharynx. So, I mean, I know this is not something that everyone's going to be screening people for, but if you're in a chair and someone's going, oh, you're Mallampati 3, tonsil score 4, and you have this or that going on, I want you to have some basic insight on this. Another big thing that you can look at is tongue scalloping, and I'll show you a picture of that in a few minutes, but that's a very quick way that you can screen yourself, because research is now showing that 89% of people that have scalloping of the tongue have some sort of sleep disordered breathing, whether that be a true sleep apnea or an obstructive sleep apnea like what we're kind of talking about right now. But we know that those people need to have attention by a professional. They need to be screened. All right. So the first point of research that I kind of wanted to go over tonight was the damage that's caused by sleeping or by snoring itself. So this is an article that looks at the axons and the Schwann cells that are damaged. So axons, basically it all breaks down to the proximal nerves of the soft palate is associated with the pharyngeal dysfunction. In snorers, the patients with sleep apnea, the most likely cause of nerve injury is traumatic snoring vibration and tissue stretch, leading to a swallowing dysfunction and increased risk for upper airway obstruction during sleep. So, the more vibration that we have, the more lax all the muscles are going to become. Those muscles kind of start to drape downward in that soft tissue. The nerves are no longer firing and able to receive message because they no longer reach that far. Your nerves are not going to stretch like a lot of soft tissue will. So it makes sense if we step back and think about it. But yes, snoring alone, no other complication, is causing damage. The next one, I wanted to focus a little bit on the women's health here. This one here is talking about sleep apnea and the heart. So in both men and women with sleep apnea and snoring, they tend to have a larger left ventricle of the heart, meaning that the walls were enlarged, and the heart was working harder to pump. What was more significant was the difference found in the size of the left ventricle among women compared to men. These cardiac changes in self-reported snorers suggest early heart impairment in women and could point to an undiagnosed sleep apnea. I pulled my next article from JAMA. This is about the association of chronic bronchitis and lung fibrosis associated with snoring. And it says just that snoring is associated with chronic bronchitis. Their findings supported that hypothesis that snoring influences the development of chronic bronchitis. And so we see these people all the time. We see them constantly sick, dealing with something, suffering with something, and oh, I just have chronic bronchitis. I have seasonal allergies. Well, seasonal allergies don't last all year long. They don't. People with asthma should be able to have relief and not be on medication every day of their lives forever. If we're just treating the symptoms and never getting into the root cause, then that's what we're going to be doing. We're going to be medicating people for their entire lives. I want you guys to stop and think, like, is this a fundamentally the correct approach for us? So with my next article, I wanted to get to some good news, and that's first that with a little neuroplasticity and some correction of airway breathing, that this is reversible. So all of these things that we've talked about being damaged can be repaired. This article says neurotrophic factor BDNF is upregulated in soft palate muscles of snorers and sleep apnea patients. So that neurotrophic factor that causes all of this stuff to overgrow and overdevelop is activated, is upregulated when we're snoring. And the findings are proposed that the damage of the airway muscles might heal following treatment for snoring and sleep apnea. And when they followed a number of patients, they found just that. And of course, this needs some more research. We need to really push forward and see how well we can help people with the research and different exercises to firm up those pharyngeal muscles. But to me, this is hope. This is saying that if we turn off the snoring, we can turn off this upregulation and return people's lives to normal. That's exciting to me. Alright, so why should you get tested? There's a lot of reasons that we've kind of already gone over, and I might repeat myself a little bit here, but 80% of those who snore have an OSA, so that's an obstructive sleep apnea, and you owe it to yourself and your loved ones to be tested. There is an estimated 40 million Americans living with undiagnosed sleep apnea. What is being treated are the symptoms. We've talked about that. So we're paying and treating diabetes, heart disease, stroke, and weight gain. And those are billion-dollar industries. In fact, it's $154 billion is spent treating those diseases that are related to sleep apnea. Not treating sleep apnea itself, not in CPAPs, not in dental appliances, not in dentistry at all. I'm talking about just medical dollars, pharmaceutical dollars, $154 billion. That is a huge amount of money that is being used to treat symptoms. A person's mental health includes cognitive function, quality of life, mood, depression, energy levels, and satisfying interpersonal relationships. Mental health disorders affect nearly 1 in 17 U.S. adults and are a leading cause for disability in this country. recent research has shown that corresponding relationships between physical and mental health and chronic diseases like obstructive sleep apnea, which are major limiting factors to our physical health, will also decrease the likelihood of an individual establishing health-promoting behaviors. So if you are too tired, you're not going to go to the gym. If you are so exhausted, are you going to go and run at the park with your kids? That's exactly what that research says. I mean, we live in a world where research like this has to be done because they're saying, oh, it's snoring, it's nothing. But we got to show people they need evidence that it's something. Well, here it is. They did the research for you, and you can read that, or you can observe life. It's your choice. But it's there. This is a reality that is an epidemic in our country that we have to deal with. And one of the things that I get feedback on all the time is it's so expensive to get tested, or I don't know how, or I don't know where to go. Great. Let's have a conversation. I'm here. And did you guys even know that you can get tested online? There's a few different resources out there, and I can make some links available, but that's private, right? So you go online, you say, hey, I need this. They send you a kit, you sleep with it for a couple of nights, you mail it back, and a licensed sleep medicine doctor interprets those results and gives you the findings. So there's a lot of reasons that people would want to do this privately. Let's think about it. If you were a pilot, a long-haul truck driver, or anyone that had, I don't know, other lives in your hands, do you want your employer to know that you have this disease? Probably not. And a lot of things might get flagged through your insurance and label you as a high risk. So, doing a private health study, it won't, I mean, many don't want the health insurance or medical records to have a permanent record of their results. That's understandable. A lot of the online studies that are not done where you're paying for an appointment on top of them and paying for that FaceTime with a provider, they're a lot less cost-wise. So there are a lot of undiagnosed and unrecognized patients out there. We spoke earlier about there being 40 million undiagnosed people suffering from obstructive sleep apnea, and that's just getting worse. And those people are currently going completely untreated. And then there's this trend of fewer physicians are going into this market or into this specialty of sleep medicine. So we have this bottleneck with this growing population that needs it and less providers that are going to do it. And it's one of the reasons that I like some of these situations where you can send it off and have people read it for you instead of having to drive a number of miles or take off work to go and have this done. Alright, so I know tonight's talk was mostly on snoring, but I've made these little, like, brochure front things that I have on a slideshow in my office just to kind of help spark conversation and have an image to help explain what I'm talking about. And I found that it's sparked a lot of conversation that I really wasn't expecting about themselves and about people they observe in public, and I thought I'd share it with you guys. So this first one here, if you were diagnosed with sleep apnea, this would be a CPAP. One on an adult and one on a kid, and I know the little kid one is so cute. It's called a wisp, and it's very unfortunate that that young man has to wear this, but at the same time I'm grateful that he is getting oxygen while he's sleeping, and he will grow and form and be a normal human. And then at the top you'll see these little bubbles, and these are just kind of little fact things. And so I put lax pharyngeal muscles, tongue, meaning posture, tonsils, and adenoids. So all of that has to do with obstructive sleep apnea and what someone like me as a myofunctional therapist could do to help. There's a lot of research out there that's showing not necessarily that myofunctional is the best thing you could do for sleep apnea, but it's taking people that are on CPAPs and then putting them through therapy and doing like a control group of who is on it and who is not, and basically they're showing that the people that are doing myofunctional therapy alongside of their CPAP are getting better results, better sleep, actual oxygen saturation, and over time, if they follow through with these programs, they're able to go from a full face mask to just a little nose cannula, and actually when they do their final sleep studies after 3 or 4 rounds, some sleep medicine doctors are recommending that they no longer need this. Now, I'm not a sleep medicine doctor. I don't know how many times I have to say that. I'm not promising anyone that that's going to be for them. But what I want you to think about is if you are in a situation that you feel like I cannot sleep with my CPAP, I want you to recognize that you can't sleep without it. Maybe we can try some alternative therapies so that at some day you might need less of it or you might not need it. But I can't tell you that you don't need that. That needs to be a new sleep study with a formal diagnosis saying, yes, you need this, or yes, you don't. And I want you to remember that just because you get an area in shape, you go to the gym, you work really hard, and you get it working for you, and if you stop, it all goes back. And so if we go through myofunctional therapy, we get those sessions, we get you off of CPAP, and everybody's happy, but then you don't follow up and continue doing your workouts, then the soft tissue is going to come back, the snoring is going to come back, and that's just the beast that it is. Okay? The second set of images I have here are tongue scalloping. And I mentioned this earlier because 89% of people with tongue scalloping have sleep apnea, have obstructive sleep apnea. So that's a really quick way, kind of just lightly stick your tongue out in a mirror. Do you have any ridges? Does your spouse have ridges there? It's something you're going to start seeing on TV, and I'm ruining like every baseball game for you ever because those guys sit with their mouth open all the time. That's okay. You'll see it. Alright, with these three here, a lot of people don't realize that insomnia or going to the restroom a lot can be a cause or a red flag for sleep apnea. So when we're not getting enough oxygen in our sleep, our brain is much smarter than we are. And it says, if I let you go to sleep, then I'm not going to get the oxygen that I need, and I'm more important than you. So right before bed, I'm going to think about the worst things ever. Whether that be the problems in your relationship, whether that be issues at work or family. We're going to just dive into all of that right now. That way you're awake, sitting up. You might be crying, but I'm getting oxygen. And then there's this whole thing with restless leg syndrome, and we heard about it for a few years, and then it became restless body, and now they're saying, well, a lot of that is those cells are not getting the oxygen that they need, so they're sending signals to the brain saying kick. And you're kicking because you need to move. And you've got to move because however you're laying, whether that be on your side or on your back or on your stomach, if you're not moving, you're probably not breathing. And that's why it partially wakes you up. It might completely wake your partner up, but we're going to make you move. If having you move is not enough, the next little flare that the body sends off is you now have to pee. Whether you have to pee or not, you have to pee. You get up and go. Let me breathe. Stop what you're doing. So if you're starting to see this trend where, 5 years ago, I didn't wake up at all to go to the bathroom in the middle of the night, and now I'm waking up at like 3 a.m. Maybe that's because we're finally hitting those deeper levels of sleep and we're almost getting rest, and the oxygen saturation goes down, and so it sends off every red flag possible and makes you get out of bed. Alright, this little blue square here, this is open mouth posture. These poor kiddos are completely rescue breathing through their mouth all the time, and they've lost the ability to breathe through their nose. This is a big problem because it's going to dehydrate all the soft tissues in the mouth. It's going to make plaque and tartar a bigger issue. It makes swelling of the tonsils because they're doing everything they can to filter the air, which, by the way, when the tonsils are in the way and the soft palate goes down, absolutely, we're talking sleep apnea, and that's probably how you end up with those lovely little kids in that mask like we saw earlier, this guy here. And while it's adorable and got a giraffe print on it, can most kids do this? Are they going to be compliant? Do we want to feel like our kid might not be breathing in the other room? No mom wants that. So this is something that should be addressed and corrected. I love to work with this as a myofunctional therapist in the sense that we can do different exercises to help reestablish nasal breathing and lip seal. One of the big things is that we can't do this alone. If we need the support of an ENT or an ear, nose, and throat doctor because they're having problems with adenoids or a deviated septum or something going on, those referrals have to be made. So we can't just expect these kids to just close their lips and stop, because if they physically can't breathe and they've been neurologically programmed to breathe through their mouth because that's the only way they're going to survive, then that's what we're going to have to expect from them. So find someone to help you screen why this is going on and then correct this behavior before it becomes something worse. Alright, the last little square over here, I want you to notice how all of them have their head up and back. So this is called craning of the neck. This is getting the most airway possible. They're pushing that lower jaw forward a little bit because we have something in the way that they can't breathe. This is not a normal, comfortable, if I'm going to think about sleeping posture. You'll never see a cartoon drawn of a normal person sleeping like this because it doesn't look exactly comfortable. But this is a huge red flag. We should tell our spouse. We should, talk to the doctor if it's our kids, because this is something saying they can't breathe. Now, if this is one night because they've had a stuffy nose all day, that's not a big deal. If this is normal, or if this is more than a couple weeks, let's get them in and get them tested and see exactly how we can help. So the next three here are all in the mouth symptoms that might be a little harder for you to see, but a lot of you invest a lot of money here. So this is how dentistry treats the symptom and not the cause often. In that first little set of images in the dark blue, this is abfraction. So it looks like a little lumberjack chopped off a piece of your teeth. And I want you to think about it as these teeth in the mid-mouth have a big head and a skinny little root, and when they're put under enough pressure, they make a flex point right where that enamel junction is, and it pops off micro little bits of enamel at that flexure point. And it slowly gets deeper and deeper till it makes that little wedge out like the lumberjack got after it. That is abfraction. It is caused by either clenching or traumatic occlusion. So clenching, you're going, how does that have anything to do with snoring? Well, it does, in the sense of sleep apnea. So if the brain is not getting enough oxygen, it's going, like I said, to be a lot smarter than us, because it knows that if it clenches your jaw, that it dilates all the blood vessels in your cheeks and those big old masseter muscles, and it will push oxygen and blood flow directly to the brain. I just learned this. I'm really excited about it. I've been working with patients for a long time and telling them that, we can put fillings in there, but if we don't correct the underlying problem, which is clenching, that you're going to pop that filling out. And my answer forever, and still is for a lot of people, is a night guard. So that night guard is going to absorb the forces and keep us from breaking our teeth further. But at the same time, I feel like we need to make sure we're assessing that airway, because if we put the wrong kind of night guard in there, we were going to block more of what's in the mouth. Or we're going to have your mouth too far open where you can't get a good lip seal and you're going to mouth breathe. And so I think that we're all stepping back and really fundamentally looking at our recommendations here, because we could do harm. And that's not the intention ever. But think about it. How many people have put in fillings there and not realizing they needed to stop, and put a guard in, or put the fillings and a guard, and they're still doing this because they still have an airway issue. If this is you, let's have a conversation. The one in the middle, clinching again. So we know clinching, getting dilated vessels, pushing oxygen to the brain. So you'll see these like bumps down there. This is a lower jaw that you're looking at. And I know there's some other things going on in the picture, but the little like bumps right on the inside of the teeth there, those are called tori. They look like little cancer growths, but they're not. As long as you have them bilaterally, they're semi-symmetrical, there's not much to worry about. What this is the jaw saying, I'm a mandible muscle, I'm only this thick, you're putting way too much force on me, and so I'm going to fatten myself up to be nice and strong. This is caused by clenching. There can be some genetic components to it. A lot of it is because mom did it, dad did it. How many people in a family are going to have an airway issue? Well, we all have the same genetics. We're all going to have the same symptoms. So yes, a lot of us are going to be having some of the same conditions here. This last one can be a little harder. This is attrition. This is just where the top picture is a lot less advanced than the lower one. You can see that they've sheared off the edge of those teeth, or just barely starting to get that bilaminate effect where we can see like the circle of enamel on the outside. It's not short enough where we can see the discoloration of the dentin or the root chamber getting close, but on the bottom you can see those. You can see like the rings on the tree, and the little dotted lines are helping you see where the teeth used to be at one point, or should be. When this is done just in the front teeth or the anterior teeth, canine to canine, often this is because of the way that we're breathing at night, and we'll advance or push our jaw forward. And when we push our jaw forward, we're opening our airway naturally. And so a lot of people are like, oh, I don't grind my teeth. No, you might not go like a crazy person and grind your teeth, but if you subtly over time are pushing that jaw forward and you're lightly grazing the top teeth and the bottom teeth together where they should not be touching, they're going to slowly erase each other away. So this is a big issue. This is looking at grinding, this is looking at sleep apnea, because we can see this. This is a huge clinical sign that something is going on. All the rest of the little cards that I made had nothing to do with sleep apnea or snoring, and so I'm going to leave those off of today's little presentation. But there's more information out there if you want to come and visit us at the office. I'm currently practicing through Savannah Dental Care in Aubrey, Texas. We can have full conversations about this if you're looking for a cleaning and exam. Dr. Barrett is pretty amazing dentist. And then if you just want to have a consultation, I do complimentary consultations for myofunctional therapy, mostly on Wednesdays and Saturdays. Give me a call. I'd love to help you guys out. And then until next time, I'll see you around.